Last year, we covered the Lown Institute's 2019 Shkreli Awards, a top 10 list of the worst examples of profiteering and dysfunction in healthcare. They recently released their list of 2020 awards, and they're just as good, meaning bad, as last year's. And they're the topic of this week's Healthcare Triage. As a quick reminder, Martin Shkreli is the former CEO of Pharmaceuticals and is well known for raising the price of an antiparasitic drug from $13.50 a pill to $750 a pill after obtaining the manufacturing license for it. He doesn't have a lot of fans, but he's got these awards to honor his legacy. This year's awards highlight healthcare dysfunction related to the COVID-19 pandemic, and there are some doozies. The number 10 spot for 2020 goes to physician staffing companies Team Health and Envision. These companies spent a lot of money last year on political ads targeting surprise billing legislation. Surprise billing is what happens when an insured individual receives care from an out-of-network provider without their knowledge, for example, in an emergency situation, and ends up receiving an outrageously high bill for it that will not be covered by their insurance. Many people have been fighting to make it illegal for years, but the people who profit from it are, surprise, not big fans. And the kicker? Alongside spending billions to help keep surprise billing legal, these companies cut pay and benefits for clinicians during the first wave of COVID-19. And if you don't dislike them enough already, the parent company of Envision received $60 million in interest-free loans from the CARES Act. Thanks, taxpayers who are subject to surprise billing. The number 9 spot was awarded to some of the arch nemeses of healthcare triage, people who peddle and or profit off medical untruths. This one is specifically for those selling fake cures for COVID-19, including televangelist Jim Baker and his Silver Solution, and Mike Lindell, the CEO of MyPillow, who claimed the plant extract oleandrin could cure COVID. Not only do these products not help, each can cause serious harm. And a special shout out to doctors like Jennings Ryan Staley, who were indicted for selling COVID-19 treatment packs. For a cool $4,000, these packs provided hydroxychloroquine, antibiotics, Xanax, and Viagra. So absolutely nothing to help with COVID-19. The number 8 spot went to Dr. Stephen Murphy, who used public COVID-19 testing sites in Connecticut to run way more than just COVID-19 tests. He tried billing people's insurance for large panels of other tests, along with ridiculous charges like $480 to deliver results over the phone. The number 7 spot went to hospitals who punished clinicians for wearing masks. Clinicians were accused of scaring patients by wearing N95 masks and other protective equipment, and they were suspended or fired. Speaking out about safety issues related to COVID-19 was also a one-way ticket for some clinicians to be let go. The number 6 spot goes to the CEO of Brigham and Women's Hospital, Dr. Elizabeth Nabel. Dr. Nabel penned an op-ed on how drug innovation is dependent on high drug prices. In this piece, she failed to disclose the $487,500 in stock options she received as a member of the board of Moderna, which was developing a COVID-19 vaccine. When the company's stock almost quadrupled in 2020 with news of their vaccine success, Nabel sold $8.5 million worth of her stock. Not a good look, per the Lown Institute. The number 5 spot went to AstraZeneca, GlaxoSmithKline, Pfizer, and Johnson & Johnson. These companies turned their nose up at the COVID-19 Technology Access Pool, an effort led by the World Health Organization to make for easier development and distribution of COVID-19 treatments, vaccines, and diagnostics by sharing trial data and patent rights. It's easily understood why these companies would balk at this, but the Lown Institute's awards panel clearly thought this year wasn't the year to refuse. The number 4 spot went to U.S. nursing homes, where more than 100,000 residents and staff have been lost to COVID-19 since late November of 2020. Nursing homes are often chronically understaffed and have thus suffered from issues for years. Then the pandemic arrived and things got even worse. One example provided by the Lown Institute: the Soldiers Home Veterans Nursing Home in Holyoke, Massachusetts was low on staff, so they chose to combine the COVID-19 unit with another dementia unit, resulting in the death of 76 residents. The number 3 spot went to 4 major hospital systems in California who had plenty of extra beds, but refused to take certain patients from neighboring hospitals that were overloaded and out of beds. How did they decide which patients? No admittance for those who were uninsured, on Medicaid, or who had other insurance-related issues. The number 2 spot, and I'm not sure I can totally get on board with this one, went to Moderna, whose development of the COVID-19 vaccine was 100% bankrolled by the US government, i.e. by we the people, and who then proceeded to set a price for their vaccine higher than any other vaccine so far. Though we are very, very grateful for the vaccine, and they've made some price concessions since then, the optics earned them the ire of the awards committee. And the number 1 spot for the 2020 Shkreli Awards goes to the Federal Personal Protective Equipment Task Force. FEMA's PPE Procurement Task Force launched Project Airbridge to bring PPE quickly to the U.S. from overseas. However, when those supplies arrived, they were given not to the states who desperately needed them, but to 6 private medical supply companies. These companies were free to sell to the highest bidder, creating a bidding war among states trying to provide for healthcare workers in the middle of a global pandemic. And adding insult to injury, in several instances, federal agencies either outbid states for the PPE or simply seized supplies they had purchased. American healthcare, best in the world, am I right? Hey, did you enjoy this episode? You might enjoy this previous episode we did on COVID reinfection. We'd also appreciate if you'd like the video, subscribe down below, and consider going to patreon.com/healthcaretriage, where you can help make the show bigger and better, even during a global pandemic. We'd like to especially thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral, Sam.